Recovery after a buried or hidden penis release involves maintaining the dressing on the skin graft. So there's going to be a skin graft around the penile shaft, and it's a fairly complicated dressing that I put in place to keep the skin graft held in place while it heals. We have to leave that in place for about a week. You can still pee like you normally would. It is just important that that dressing and wrap around the penile shaft not be manipulated during that first week. You can shower and keep everything clean. I do ask that you not take a bath or go underwater because I don't want that dressing around the penile shaft to become really wet and saturated. So a sponge bath or a shower, if you can keep the water off of that dressing, would be best. So you can shower right away. Just do your best to keep the dressing around the penile shaft dry. After 1 week, we will remove the dressings off of the penile shaft, and then what you need to do is keep that skin very moist as the skin graft is still maturing and healing. So keep it clean with soapy water and moist with Aquaphor or bacitracin. If that area of your body is already too moist, you probably don't need to add a whole lot of moisture, but we do not want that skin graft to dry out. If you start to develop a yeast infection, let me know and we will start you on nystatin cream right away. It is also important that you keep your blood sugar under control as well as your blood pressure and other comorbidities as well optimized as possible. I do not want you to have sexual intercourse for 2 months following the procedure. In other words, you want to give that skin graft a good 2 months or 8 weeks of healing before it is exposed to any shear forces or friction, and therefore you cannot have sex or masturbate or anything for 2 months following a hidden or buried penis release. You will have a skin graft donor site. If I performed a paniculectomy at the same time, the skin graft donor site will be gone as part of the paniculectomy. If you had no other procedures performed, I may need to use your thigh as a skin graft donor site, in which case you would take care of that by keeping the area moist with bacitracin or Vaseline, which is applied to the yellow gauze that is sutured down to your thigh. So you'll apply the moisturizing ointment on top of the yellow gauze. It'll soak through the yellow gauze to keep the healing skin graft donor site underneath it moist. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.